Hi, everyone. Welcome to our 8th session of COVID-19 Colorado Beyond. This webinar is sponsored by the University of Colorado Denver's College of Liberal Arts and Sciences and its continuing and professional education and interdisciplinary studies programs. I'm Marjorie Levine Clark, and I'm a professor of history and the Associate Dean for Diversity, Outreach, and Initiatives in the college, and I have been moderating this series. Please use the Q&A feature at the bottom of your screen to ask questions during the lecture, and we'll get to those questions at the end of the presentation. Information about student credit and continuing education units can be found on our continuing and professional education website. And students interested in credit, you know by now, have to write a one-page paper for every lecture. And today's prompt for the paper is, how has the COVID-19 pandemic impacted mental health and psychosocial well-being? And please provide several examples from the lecture. I'll say that again. How has the COVID-19 pandemic impacted mental health and psychosocial well-being? Please provide several examples from the lecture. And this prompt will also be posted on the course website along with all the other questions. The lecture is also being recorded and it will be up on the website and the CLAS YouTube page as well. And the slides will also be up on the website. So as usual, I'm going to thank many people who made this webinar happen. First, our Dean, Pam Jansma, and Assistant Dean, Joanne Porter from the College of Liberal Arts and Sciences for supporting this program and making credit available to many of our students at no cost. Our outstanding faculty who volunteered their time for this series, Mike Effler and Noah Dodero from the Office of Information Technology, Shana Bull, Amy Arnold, and the Office of Digital Education, Interim Associate Vice Chancellor of Academic Affairs, Joanne Brennan, the University Registrar, Carrie John, and her team, Associate Bursar, Eric Gray, and from the College of Liberal Arts and Sciences, Tracy Combe, who is the Director of Marketing and Communication, Laurel Dodds, our Director of Continuing and Professional Education, our Course and Curriculum Coordinator, Mary Lovett, and Kristen Salisbury, who's Program Manager for Continuing and Professional Education and who oversaw putting this whole event together. Today's lecturer is Associate Professor Kristin Kilbourn from the Department of Psychology. Professor Kilbourn received her PhD from the University of Miami in clinical health psychology, and she serves as a core faculty member in the clinical health psychology doctoral program. Her research focuses on psychosocial oncology, cancer survivorship, and palliative care. She also has a strong interest in studying health disparities. Her talk today will be on the psychosocial well-being during a pandemic. Welcome, Professor Kilbourn.
Hello, great to be here today. I am going to pull up my slides. And I think you should all be able to see now. Here we go. So thank you for allowing me to speak today on psychosocial well-being during a pandemic. I've been particularly interested in this area because in addition to my doctorate in clinical psychology, I also have a master's in public health. So really interested in that intersection between psychology and public health. And this is really a perfect place to study and talk about how these two intersect. So just to present an overview of what I'm going to talk about today, first, I'm just going to present what we know about the impact that COVID-19 has had on mental health. I'm also going to talk about some of the specific populations that are at increased risk for suffering and experiencing severe psychological distress as a result of the pandemic. I'm also going to talk about how psychological factors influence things like risk perception. And I'm going to end talking a little bit about how you could manage some of your own COVID-19 distress and hopefully some helpful tips and ideas and suggestions. So I thought I would start with a quote from the American Psychological Association, which I think really we can all relate to. It also shows sort of this crossover of public health and psychology. And so they wrote, "The coronavirus pandemic is an epidemiological and psychological crisis. The enormity of living in isolation, changes in our daily lives, job loss, financial hardship, and grief over the death of loved ones has the potential to affect the mental health and well-being of many." So I know that everyone probably who is listening to this talk can relate to the stress that they've endured over the past few months. But what is it about this pandemic that's made it so stressful? Well, first is the high degree of uncertainty. And when you think about it, we're really not used to living with this level of uncertainty for such a long period of time. And so it's really been something that we've had to learn to adapt to. We've also had to learn to adapt to limited resources, whether it be toilet paper, paper towels, potentially hospital beds, ventilators. That's again something that most of us in our lifetime have not had to live with or had to even think about. We're also dealing with unfamiliar public health measures and recommendations that are things that we've never considered, but also are changing all the time. There's conflicting messages from people in leadership positions and in authority, which makes things even more confusing and difficult to process, as well as just changes that are often unpredictable and when they're going to occur and what's going to happen and all the unknowns regarding the future. I think the other thing too is just to recognize that most of us have no prior experience with pandemics or dealing with these types of public health crises, so we have nothing to compare them to. I thought it was interesting at the very beginning when this all started. I think the closest thing that as a nation we could compare this to was 9/11. And there are a lot of comparisons to that. But now that we've gotten months and months away from that, I think we're recognizing that this is quite different. But perhaps initially that was the closest thing that we could relate to. So what about the psychological impact? Well, certainly we've seen an increase in distress. This is information from a survey that the CDC sent out. So respondents described increase in anxiety, depression, fear, and worry. We are seeing in the mental health world more calls to crisis lines, more people who are interested in seeking out help. We are seeing an increase in unhealthy behaviors, so that may include alcohol, marijuana use, tobacco, other kinds of drugs. People are reporting changes in sleep, in their exercise and eating patterns, and also difficulties with concentration and memory. Now, as you might imagine, there have not been a lot of studies yet looking at distress in the population, and certainly not a lot here in the US. But there was a large longitudinal study that was done in China that's been published. They had over 1,700 people. And not surprisingly, they found very high levels of distress across the population, so that the mean distress scores were above the clinical cutoff for post-traumatic stress disorder, which means we expect that there are a high number of people that will experience symptoms of PTSD. As you can see, there are pretty high percent of people that fell in that moderate to severe range for stress, anxiety, and depression, with, again, not surprisingly, anxiety was almost 30% that reported moderate to severe symptoms. Interestingly, they also looked at factors that could be protective, help protect people from experiencing high levels of distress. And some of those included things like having a high level of confidence in doctors, the perception that the likelihood that as an individual you would survive COVID if you were to contract it, or that you had a low risk of contracting COVID-19 seemed to be protective for distress. Satisfaction with health information, feeling like they could trust the information that they were receiving, also was was associated with lower levels of distress, and also the use of personal precautionary measures. So I want to talk a little bit about some groups in particular that, as a psychologist, we're looking at and have some concerns in terms of how they're managing distress both right now and in the future. So the first group is a group that we've heard a lot about, and this is the group that is, for the most part, sheltering at home, continuing to shelter at home. The group of the over age 60 nursing home residents with comorbidities, or they may have people with comorbidities or compromised immune systems. Those, now we know that people with blood type A may be higher risk in contracting COVID and experiencing severe effects of COVID. And so, as I mentioned, despite the fact that many places have reopened or gone back to more of sort of their usual way of operating, this is a group that, for the most part, what we know has continued to shelter in place and really try to social distance. And so, as you might imagine, this group has now been experiencing a really high degree of change in their lives for the last, 4+ months, with really no end in sight into when they're going to be able to safely sort of resume their activities outside their household or their residence. And they've also experienced high levels of loss in terms of their control, personal control. We know from the literature, separate from COVID-19, that this is very much associated, this idea of personal control, mastery, being able to make your own decisions, is associated with psychosocial well-being, as well as morbidity and mortality. So this is of concern, that this population feeling like they don't have a lot of control probably is putting them at higher risk, even separate from COVID-19, for different types of issues in terms of well-being and their own health, mortality, and morbidity. We also know that this group is experiencing more loneliness. You think about those pictures that we see, those things we see where people who are living in nursing homes and they're unable to have face-to-face contact with their loved ones and seeing them through the windows and things like that. And again, separate from COVID-19, we know that there's a 45% increased risk of death in seniors who report feeling lonely. So this is, again, of great concern of how are they coping with the feelings of loneliness and some of the effects we may see down the line. Additionally, this population is having to manage their own fear and uncertainty regarding illness. What if they get sick? And what will the end of their life look like? I'm going to talk a little bit more about that later, but that's a different fear perhaps than other groups may be thinking about. And then also, as a health psychologist, this is something that I've been thinking about, and the collaborators that I work with in oncology, is the decreased attention to their self-care in this group, as well as attention to their own comorbidities. So it's been much harder to get into the doctor, to seek attention if you have new symptoms from some other kind of medical illness. We're worrying a lot about prevention activities, in the area of cancer prevention, and early detection is really important. People who are missing their mammograms, colonoscopies, all these different prevention types of activities that have been missed, and what that's going to mean down the road. The next group to be thinking about in terms of being at really high risk for psychosocial consequences are those with pre-existing psychiatric disorders. And you don't have to think very hard about this to recognize that, especially things like people with obsessive compulsive disorders, especially those who have a tendency either towards hoarding or contamination and cleaning obsessions, could be experiencing a big exacerbation in their symptoms as a result of the pandemic. We know that people with recurrent depressive disorders tend to be at high risk for a relapse for depression when they're socially isolated. So that's been a concern. Not surprisingly at all, anxiety disorder. So people who already have a history of anxiety are more likely to experience, again, an increase in anxiety, especially those with social anxiety or agoraphobia. So there's a concern that there's going to be a whole group of people when that day comes that we're all really can feel safe about leaving our homes that aren't going to be able to leave their homes. We know that people that have sleep disorders and insomnia have noticed an uptick in their symptoms. People with past trauma, we know that with post-traumatic stress disorder, people who've had past trauma, a new trauma can then trigger that many of their symptoms. Substance use disorders, we're really worried about that people who may have been sober and abstained from substance use for long periods may have had to turn back to that as a mechanism for coping, as well as people with opioid disorders or other kinds of problems may have had difficulty getting medication, which could have exacerbated some of their issues and problems. And then lastly, just thinking about those people who have chronic mental health conditions like bipolar disorder or psychotic disorders, who may have had difficulty getting the medications that they need, which again can lead to an increase of symptoms and different problems related to their illness. I also think it's important to recognize how this pandemic has really shined a light on health disparities that have always been there. And those of us who work in this area have been very aware of. But now with COVID-19, these have become very evident. And my hope is that hopefully people will be, now that they're more aware, will be able to do some work in this area. But just to give you some numbers, we know that COVID rates are much higher, as much as 5 times higher in Black and Native American populations than that of white Americans, 4 times higher in Latinx populations than white Americans. Also higher rates of hospitalization and death rates in these groups. And I think also it's important to recognize, and I know that there was a lecture on this earlier on this summer, but there's been an increase in racist attacks and discrimination, especially in Asian and Black populations. So a recent study that was done by the Pew Research Center and the CDC noted that a survey that they sent out, 4 in 10 Black and Asian adults reported that others have acted uncomfortable around them because of their race or ethnicity since the pandemic. And 58% of Asian adults say it's more common for people to express racially insensitive views about people who are Asian since the coronavirus outbreak. So again, these are all groups that are at higher risk for psychological problems and concerns. A group that I am especially interested in, and I've actually been doing some work at Anschutz in the psychiatry department, where we've been offering virtual groups for healthcare workers, where that just for a chance to support them and allow them to talk about their experiences, help them with their coping strategies, and give them some ideas of things that could be helpful. This is a group that I have great concern about. You know, this is a group that really had to develop a lot of things on their own, lacked a lot of resources, at least initially, felt like there was poor preparation for the pandemic and what they needed to do. We're living with day to day and are continuing to that fear for themselves of contracting the illness or spreading it to their family and loved ones, and have also experienced a change in their usual work duties and schedule. So, you know, I've been talking with people, you know, for an example, where, you know, out at Anschutz, they had the entire orthopedic floor had to be converted to a COVID floor. And many of the healthcare workers that were used to working in orthopedics had to very quickly learn how to care for COVID patients, which, as you can imagine, is very, very different than what they were used to. And schedule changes and different kinds of demands is all very, very stressful. There's also been talk about this idea of moral injury in this group. And this is associated with feelings of betrayal, feeling like leadership let them down. There's been talks about how healthcare workers, some doctors felt like they weren't allowed to speak up about their experiences or the lack of resources, lack of preparation. There's been, this experience of trauma in this group, having to make very difficult ethical decisions that most healthcare workers never thought that they would have to make. This is going to be associated, we expect, with high levels of PTSD and trauma, as well as compassion, fatigue, and burnout. There's this expectation that there may be this whole group of healthcare workers that may end up leaving the field. We know from one study that looked at psychological distress in over 1,200 healthcare workers in China, found very high rates, as you can see, 50% depression, 44% had anxiety, high rates of insomnia, and over 70% had very high levels of distress. A group that has not received a lot of attention, maybe a little more attention recently, are the COVID-19 survivors. So we see a lot on the news and we read about these wonderful stories about people who were in the ICU on ventilators for 30 days, 40 days, and are now coming home. And their happiness, the happiness of the healthcare workers, happiness of their families. But we don't talk a lot about some of the long-term effects that these people are likely to suffer. So separate from COVID-19, we already know from the research that there is a very common ICU-related trauma and PTSD-like symptoms, people who spend a long time in the ICU. We know that being on a ventilator is particularly traumatic. My own experience of working with people who have been on ventilators, many of them have said that if they knew what it was going to be like, they would not choose that again. They would have chosen to not be put on a ventilator. So we're expecting to see, a lot of psychological trauma in this group. They're also there's a lot coming out now about the neurological impact of COVID-19, brain fog, delirium, different types of cognitive issues, and also the development of potential new long-term health issues associated with, whether it's associated with COVID-19 or potentially associated with the life-saving treatments that these people received. It's also important to remember the caregivers. So loved ones who cared for someone in their family or friend who had COVID-19 and the stress that they endured and trying to balance their own risk, their perceived risk of getting the illness versus caring for their loved one. So another group that I think we're going to see high levels of distress. So as you heard in the introduction, I do a lot of work in palliative care, and I think it's really important to note how COVID-19 has really changed the process of death and dying, at least the process of death and dying with COVID-19, which I think is going to have long-lasting effects. So from the perspective of the person who's dying, who's in the hospital, who doesn't get to have those last face-to-face moments with their loved ones. Some are able to have the virtual, but that's not the same, as we all know. For loved ones who feel like they miss those final moments, to be there, to just be able to hold their hand of their loved one, to have that reassurance to be with them. Many people are finding that they're having a very hard time finding closure, and there's a term for this, which is ambiguous loss that they're experiencing. In terms of memorials and funerals, people are having to find new ways to honor and remember a life. So we sort of take for granted that our typical way to help support those who have lost loved ones is to come together and support each other. And now it's very difficult to do that in a safe way. And so the expectation here is that we're likely going to see many, many people that are at high risk for prolonged or complicated grief and depression, who lost loved ones and friends to COVID-19 and never really had a way to appropriately process that loss. So what can we expect in the coming months and years as sort of the perspective of a clinical psychologist? What are we talking about? What am I talking about with my colleagues, and sort of trying to plan for, both from the clinical side as well as potential research? Well, one thing is this tsunami of grief. Given where we are now and where we'll be at the point, wherever that will be, where we can feel like most of this is behind us, we expect that almost everyone in some way is going to be touched by the loss of someone from COVID-19. And you think of many of the people who will die from COVID-19, who tend to be older in that higher risk group that we talked about. You think of all of the generations that are impacted by that, right? Their partners, their children, their grandchildren, their great-grandchildren. So this tsunami of grief is what we're seeing will be coming. We're also, as I talked about, expecting high rates of PTSD and trauma-related disorders. Again, if we compare and think about, again, we don't have a great comparison for this, but if we think about 9/11, that was something that came out, over the months and months and even years after 9/11, where we were continuing to see PTSD and trauma-related disorders. We're anticipating an increase in substance use disorders. And also, although I hope that there's not worsening health disparities, I think the belief is that it's probably going to get worse before it gets better. At least that's how it's looking. And I think the big question that we're asking is, are we going to have the mental health resources that we need to help heal our country, to help provide the need and the care that these folks are going to need? So I want to change a little bit and talk about risk perception, because I found this area to be so fascinating. And I feel like we're in this place right now with the pandemic that a lot of people are really have a lot of conflict around this, or trying to figure out how do you determine or your own risk. How do you perceive risk and determine what kinds of behaviors are safe and not safe, because we're getting different information all the time. And this is really important because it can help us predict pandemic spread, as well as public reaction to policy measures that are aimed at containing the virus. And I think there's a really good place for psychology in this area. So when we talk about risk perception and risky behavior, we're thinking about things like, how do people perceive contagious risk? We know that information is often presented in inconsistent and abstract forms, but we don't know a lot about how do people process that? How do they think about that? And how does that translate into their own behavior, and how they may change and adapt behaviors to decrease their perceived risk? How do people update their risk assessment? Again, with new information coming in all the time. If you think back to 3 months ago, we were being told that we shouldn't wear masks, that wearing masks was not helpful. Now we're being told, then we were told actually that wearing a mask was good because it protected other people. If we had symptoms, or maybe even asymptomatic, it would protect the other people that we may come in contact to. Now we're actually learning that masks can also protect us from other people, right? So we're constantly getting this new information, and how are we processing that, and how is it impacting behavior? How do people make trade-offs, right? This is a huge one, and we really have no template for this, right? How do we make trade-offs on the economic cost versus health risk, right? We want to support, for example, we want to support our local businesses, but at what risk are we ready to go back to those restaurants? And how do we figure that out? And then there's, how do we assess trust and leadership, right? And this is crucial, because if people don't trust leadership, they don't trust the experts, then how are we going to get them to adhere to recommendations and policies? Now, there is one study that I was able to find that actually looked at global predictors of risk perception, which was interesting. They found that some of the things that tended to predict risk perception included things like personal experience with the virus, the type of society or culture you live in. So as you might imagine, more individualistic societies like ours might be quite different, where personal freedom is very highly valued versus more collective types of societies where it's more focused on pro-social behaviors and how to protect and take care of others. Hearing about the virus from friends and family was associated with a perception of risk. Trust in government, science, and medical professionals. Personal knowledge of government strategy seemed to be helpful in terms of predicting risk perception. And personal and collective efficacy. So this is the idea of feeling like, if I do this, if I make this commitment to socially distance, it's going to actually have an impact. If I feel confident that's going to have an impact, that could really impact how I behave and my perception of risk. So from the social psychology, and psychology has some great theories and ideas that helps us understand, why is risk assessment so difficult? Why is this something that we really seem to be struggling with right now? So one idea that comes to play is this idea of optimistic bias. And this is just sort of human nature, that we always tend to believe our risk for something is much lower than the average person. And as you can imagine, in some ways this might be very protective and tends in protecting us from depression and getting really down and sort of seeing maybe sometimes the reality of the situation, but could also cause us to take more risk and make some bad decisions. Another idea from psychology is this idea of false sense of control. And I think we can probably all relate to this, where it's very comforting to think we have control over most things in our lives, but if we really step back and think about it, we really don't have a lot of control, but we like to think we do. And so again, this is something that we use to kind of decrease our anxiety, but that can also lead to more risky behaviors. Unclear cultural cues is a very important one. So usually when we don't know how to behave, we don't know how to act, we'll look to our cultural cues. We'll look kind of to that shared cultural knowledge. What is the right thing to do? What is the moral thing to do? And in this instance, we don't really have that right now. We've never been through this before, and we're receiving mixed information that's changing all the time. So this is an area that can be very confusing for us. We have no place to look back and kind of have some help in how to behave. Something that I think is becoming really evident now, and there's been a lot of great things that I've read in the media that writing about this, is this idea of confirmation bias. And this is, again, this human tendency that we look and seek out information that confirms our own beliefs. And a perfect example about this is that, if I feel that wearing a mask is a violation of my freedom, then I'm going to seek out information that confirms that idea. And I'm going to tend to not look at information that's going to disconfirm or conflict with what I believe. And the last one is something I think we could probably all relate to. And it comes from, I think, the best way to describe it is to talk about it in the clinical sense. So if we're seeing someone, for example, who has a high level of anxiety, let's say riding in elevators, right? One of the types of strategies and interventions that we could use with them is what we call exposure. And with exposure, which could be very difficult but is very effective, it's that idea, we're just going to expose you to that thing or that situation that produces a lot of anxiety, and you're going to eventually just get used to it, right? At some point, you're going to realize, I can't feel any more anxious. I'm getting used to always being in the elevator. And what happens, what we call it in behavioral psychology, is you habituate. You get used to that, right? You adapt to it. And we've gotten to this point now where we've kind of habituated to this level of stress and living in the world as it is right now. If you think back to mid-March and you thought this is where we would be July 15th, where we're now suddenly seeing this upswing in COVID-19, you'd be thinking, there's no way I can handle that, right? But here we are. And probably most likely many of us would say that, yeah, my anxiety level is much lower than it was back in March. I may be at higher risk now for contracting COVID-19, but I don't feel as anxious about it. So again, that's something that can lead to more risk taking. I just wanted to mention, I do think that there's great potential for research in this area. Again, it's sort of that cross section of psychology and public health, and thinking in particular about how psychological factors could impact prevention efforts. So whether it's things like use of masks, proper use of masks, quarantine, social distancing, COVID testing, getting people to get tested, contact tracing, or even adoption of a vaccine. That's something that already public health people are talking about. Like when and if, hopefully when we do have a vaccine, what kinds of things, what kind of barriers are we going to expect to see in terms of people actually getting vaccinated and adopting that. So those are kind of some things I've been thinking about. Now, I want to spend the last few minutes today talking about some strategies that may be helpful for you in terms of managing psychosocial well-being. So the first thing I always say, because I'm really big into normalizing, sometimes it's just good to normalize and recognize that we're all feeling some level of distress. And so to expect and accept that. So we know that our emotions are a result of our thoughts, and that anxiety and fear are normal and have a purpose, right? As I was just talking about, when it comes to risk perception, some level of anxiety and fear can be good to help us to behave in a way that we protect ourselves and others. When it becomes problematic is when it turns into more rumination and constant worry. We know that tends to not be very helpful in the long run. I think the other thing is to accept that you're going to experience fluctuations in your mood, motivation, and efficiency. And I'm seeing this both with, friends and colleagues, as well as the people I work with clinically, where people describe, yesterday was such a great day. I got so much done. I was really efficient. But today I just felt like I didn't even want to get out of bed. Right. So it's this is something that seems to be very normal right now. I think it's part of that living with uncertainty and that unknown, that we're experiencing more fluctuations in our mood and how we're feeling and how efficient we are. And so this leads to, I always am telling people, just please try to be gentle and patient with yourself. Set reasonable expectations. Don't set the kinds of expectations that you may have set for yourself prior to COVID-19. That's only going to lead to more distress and frustration. Now, many of you may have already seen some of these tips for managing COVID distress, but I think it's always good to review them to kind of see where you are with these. So the first one is to practice good self-care. This means really focusing on your sleep, trying as much as you can to get good quality sleep, focusing on a healthy diet, getting exercise, all those things that we know are really help our self-care, both mental and physical wellness. Maintaining a routine is really important. So for most of us, we had a probably very sort of specific routine every day, or at least during our work day, that we were used to, going to work, going to the office, seeing the people that we run into, going down the hall, seeing colleagues, picking kids up from school, all those kinds of things. We had routines on the weekends, right? One of the big things that I think when this all started, you couldn't even tell weekends from weekdays. It's just, everything changed. So I think it's really important that we try to maintain some type of routine, and this seems to be associated with less distress. Participating in distraction activities is always good. Healthy distractions, just getting away from all of this, taking breaks from it. This very much goes hand in hand with limiting exposure to media. I can tell you there's so many people that I had talked to about this list, and this was one of the big ones, that they realized that they were watching too much, reading too much, and when they were able to really put boundaries on it and step back, they really noticed an improvement in their mood, better sleep, and more time to spend in the distraction activities or doing things that they enjoyed. Also, it can be helpful to make a list of your personal strengths, just so you can remember those. Engage in pleasurable activities. A lot of people started either new hobbies or got back to old hobbies and projects they'd sort of put aside because of their busy lives. And it's been wonderful hearing about those. Mind-body activities are always really good when we're dealing with high levels of stress. They get us more into, I always say, like, my simplified version is they get us more into our right hemisphere, where all of that self-talk, all that analyzing kind of goes quiet. So things like mindfulness, grounding, yoga, tai chi, meditation, prayer, these are all really excellent self-care activities. And then focus on the things that bring meaning and value to your life, expressing gratitude and practice compassion, and try to identify and savor those positive experiences. I think every day when I'm outside and able to hike and walk around my neighborhood, I am able to focus on how grateful I am for where I live and the things I'm able to do. I want to just do a quick, I think it's important just to review the symptoms of anxiety and depression, just to remember that you always want to be aware and every once in a while check in with yourself, like how you're doing. So again, it's when you have excessive worry and anxiety, to be thinking about maybe this is a problem. Oftentimes you may feel restless, feeling on edge, irritability, high levels of fatigue or low energy. Both anxiety and depression oftentimes come with concentration and memory problems or difficulty focusing. Sometimes you see muscle tension and sleep disturbance, and then of course panic attacks. And sometimes when I ask people if they've ever had panic attacks, if they ever say to me, I'm not really sure, my answer usually is, then you probably haven't had one. Because if you've had a panic attack, you probably know what that feels like. And then again, just a quick overview of depression. So oftentimes people think of depression as sadness, but I will tell you that depression can present without sadness. Sometimes it's more an irritability or anger that people may experience, or a sense of hopelessness, and they may not necessarily feel sadness. There's also many somatic symptoms that go along with depression. This could include problems with sleep, either falling asleep or waking up early in the morning, not being able to go back to sleep, changes in appetite, low energy, fatigue, again, cognitive symptoms. One big sign of depression can be decreased interest in activities that were previously enjoyed, as well as feelings of worthlessness. And really at the extreme end are feelings that life is not worth living or suicidal thoughts. In terms of maintaining emotional well-being, what I tell people is first, just sort of monitor your physical and emotional well-being. Just every once in a while, tune into yourself. How are you doing? Sometimes I tell people, it could be as simple as using your own subjective scale from, 0 to 10, with 10 being the worst. How would I rate my, whatever you want to do, my level of stress, my level of anxiety, my mood right now? How does that compare to how it was a month ago? Review the symptoms of depression and anxiety if you think you may be experiencing some of those. And consider seeking help and support, especially if you're finding that these symptoms are interfering with your daily life, or that your quality of life has decreased as a result of these symptoms. Another sign could be that family and friends have noticed a difference, that something has changed, or you're not experiencing joy in your life. And of course, if you're ever having any thoughts that life is not worth living or that you'd be better off dead, definitely seek help immediately. And I will tell you that there is a lot of help available right now, although, we had to make a lot of changes in terms of mental health services. Everyone is very up and running in terms of telehealth. And there are some folks that are actually going back to face little by little. We have really great crisis centers here in Colorado, 24 hours. You can call, you can text, different ways that you can have someone that you can talk to. We also have places where you can go to talk to people that are not hospital-based, so you can feel safe there. And there are lots of self-help services and information that's out there also that could be very helpful. So the last thing I just want to mention, and this is partly again because of my own interest in the work that I do looking at benefit finding, is there a positive benefit to all of this? And I should say that in the area of health psychology and the populations that I work with, we talk a lot about traumatic growth. And it's this idea that through very difficult, challenging times, there is huge potential for growth in all of us. And so I want to think about and present this as an idea and how it relates to this COVID-19 pandemic that we've been going through. And I think perhaps there is potential for growth here. Certainly, I think we've all had to spend more time or hopefully reconsider what is meaningful to us and what brings a sense of meaning and purpose to our lives. Many of us, or most of us, have had to sort of reprioritize what's really important, be thinking about that. We've probably all recognized that we have an increased tolerance for uncertainty. As I mentioned, probably never expected that we could manage this level of uncertainty for so long. We've also, many of us have learned to be better at focusing on living in the moment, right? That sort of mindfulness sort of way of looking at the now rather than that focus on the future. Because right now, we don't know a lot about the future. I don't know about others, but I've sort of found myself like, I'm not going to get really anxious about my kids going back to school because I don't really know what's going to happen because things are changing so fast. So why am I going to spend a lot of energy worrying about that when it could change at any time? I'm just going to stay in the now. We also can recognize, and hopefully are recognizing, that we are perhaps more adaptable and resilient than we had thought we were. And also this experience, I think, has helped us all recognize the importance of both building and maintaining community. So we're not able to just walk over to our neighbor's house and pop in and spend some time with them. We're not able to walk down the hall and see our colleagues. We've had to work really hard at building and maintaining community and our social support networks. And with that, it helps us to recognize how important and valuable that is in our lives. So just quick in my conclusions, again, as we talked about, we know that the COVID-19 pandemic is associated with increased distress, and particularly in specific populations that are more at risk for the psychosocial impact of this pandemic. We know that COVID-19 has changed both how we live and how we die. And we expect to see a significant increase in mental health disorders over the coming months and years. Hopefully we'll have the resources available to provide services to the people who need them. We also know that perceived risk is impacted by several psychological factors, and I think there's huge potential there for both research and intervention. And lastly, I think hopefully I gave you some ideas of ways that you can manage some of your own psychosocial well-being and the distress that you may be experiencing associated with this pandemic and the stress related to it. And with that, I would like to say thank you, and I welcome your questions.
Well, thank you so much, Professor Kilbourn. That was really, really a terrific lecture. And I think we learned a lot, and this relates to, I think, a lot of what all of us are feeling right now. So you have also gotten a lot of really, really important questions, I think. So I think we have at least 7, so keep that in mind as you're answering. Are there any protocols in place for how to handle the large number of PTSD in the population, like that we're anticipating?
Yes, that's a great question. So I I know that I can't say specific protocols. We certainly have really good evidence-based interventions already for PTSD and trauma. And so I know that many of those are being adapted specifically to COVID-19. I can say that the mental health providers are preparing for this, prepared that we're going to see high levels of this. So I can tell you in our doctoral program, we are thinking ahead and the importance of training our doctoral students so they'll be prepared for this and really feel confident and in their skills in that area. So I don't know if I could say specific protocols, but we do have some very good evidence-based interventions.
Thanks. Do you think that our society will express less stigma toward people with mental health issues because the number of people who are suffering from mental health issues because of COVID?
So I love that question because I actually had that on a slide and I took it out because I felt like I wouldn't have enough time to talk about it. I have really high hopes for that. That is my hope because I do feel like this has now been, as a country, as a community, I think everyone has experienced distress. And I think there's more acceptance of this idea that people are experiencing, some mental health challenges. So I'm very much hoping that this may be what pushes us a little bit in a positive way for less stigma, and hopefully people are more inclined to seek out help and or talk about what they're experiencing. So yes, my hopefully not my optimistic bias, but I'm optimistic that this will help to decrease some of that stigma.
Thanks. It seems that in some important ways, the COVID-19 pandemic is similar to the HIV/AIDS epidemic in the 1980s and 90s. What lessons do you think we can learn or could have learned from the response to the HIV/AIDS epidemic?
Okay, so I did not plant these questions, the greatest questions, because I did what my doctorate was actually working in HIV. I did a lot of work in HIV, and it's interesting that the pandemic, especially when it first started, brought back a lot of, more recently I worked in oncology and cancer, but it was bringing back a lot of memories of working in HIV in those early days, especially where there was a lot of uncertainty, a lot of unknowns, a lot of fear. I think there's very much that we can learn from that experience. And there have been some really nice articles written about this in terms of, again, going back to how people perceive risk, how they sort of, it's, there's a great article that I read recently that talked about this comparison of, back when, HIV is still a thing, but, back in the 80s where we didn't really have a good treatment for it, and it was very much kind of a life or death sentence. I did a lot of work around communication, how, and safe sex practices, and how do you have that talk with a potential partner about risk and how to protect each other. And so there have been these really interesting correlations in how do you do that. It's the similar kind of conversation when you're deciding about like who are you going to bring into your social bubble, right? Who are the families that you're going to allow your kids to play with their kids, right? How do you have those kind of difficult conversations to sort of assess, like, are we at the same place and in terms of, how serious we take this and what kind of precautions we're taking? So I think there's a lot there that could be learned. And also, there was, I don't want to get into it, but there was definitely some political aspects to HIV too, which I think very much in the beginning hindered some of the efforts that are draw parallels to now, and perhaps learn some lessons from that that could help us going forward. So like I said, I love that question. I think there's huge potential, and I've been really happy to see people writing about that and thinking about it.
Yeah, that's fascinating. I like the way you framed that in terms of who do you bring into your bubble, right? Who, the idea of who's practicing prevention risk in the same way. It's really important. As schools and teachers plan for returning to learning in the fall, what should we expect regarding the impact on students?
Yeah, that's a really tough one. I don't know that we know very much about that. Um, we know that there's sort of, there's a group that really doesn't want to be back, and then there's a group that really wants to be back. And then, the teachers are kind of somewhere in the middle. So I don't know how much we can predict what that's going to be like. I think as a parent, trying to prepare our kids to just be very flexible and adaptable, that things may change very quickly and we'll be there and it will all be okay is the best approach, at least what I'm trying to do. But I think, the effects that this is going to have on the kids is something that's more of a big longitudinal study to see. And I think that the positive from this, kind of like my last couple slides, is that our kids have probably become more resilient than even we're recognizing, and they've grown from this experience, and hopefully they'll be able to take that with them when they go back to school. But it's hard for me to project how that's going to go. That's one of those things I try not to worry about too much because I don't know what's going to happen.
I know. I keep thinking that all the work we're doing planning, what's going to come of it, because we can't predict anything, right?
Yeah, exactly.
How does the Black Lives Matter and how do the Black Lives Matter and defund the police movements intersect with the COVID-19 pandemic? Do you think that the protests during this time of pandemic will increase the likelihood that more resources may be allocated to mental health programs in the future?
That is a really interesting, I have not thought about it from that standpoint. I mean, I guess a little bit, right? That's part of what defunding the police kind of means, is that you allocate resources to other areas. And certainly we know that that's a huge area, a huge overlap, mental health and legal kinds of issues. But that's a really interesting idea. I think that it's fascinating how these things all are occurring within the same time, and it's probably no coincidence at some level. I think, as I mentioned in my talk, my hope is that with COVID-19 and also the racial disparities becoming more of a spotlight, that now it'll go into the area of health, like where I've worked. It's becoming more evident of all the problems and issues that we've known about for a long time are now very public. But I would love to see that some of that money would be allocated to mental health. I think that's a wonderful idea. So I'll be very optimistic about that too.
All right. Thanks to Dr. Kilbourn for a really great talk. I feel really lucky to be in a decent mental state during all of this. What are ways to help either people I know personally who are struggling, or are there community efforts I can support?
That's a great question. So there will certainly just be reaching out to those people that you care about, letting them know that you care, that you're there for them. Sometimes when people are really suffering, have high levels of distress, depression, or anxiety, it's really hard for them to take action. They get stuck. So having someone who cares about them that can help them with that process, if it's seeking out someone that they can talk to or helping them get the care that they need, can be really important. In terms of community, there are, and maybe, I don't know if we have a resource list, but I can certainly put one together, and maybe if you want, we could post it on the website.
Oh, that would be a great idea.
Yeah, I'm still learning a lot about different community and state level. There have been some funds that Governor Polis has put towards mental health community-wide. It involves, some of it involves, presentations, talks, virtual groups, things like that. There are certainly virtual groups that are available. Even our clinic at the university in the psychology department, we're doing telehealth, and we're open, if you call it that. So yes, I can put something like that together and we can post it. So those of you can go to that and hopefully get some ideas of the resources that are available.
That's a really great idea. I mean, it'll be another part of the website we'll keep it under your presentation.
Perfect.
Great. How do you think habituation in the coming months will influence social adherence to pandemic precautions? I can see people getting used to the uncertainty and consequently will take more risks, like not wearing a face mask versus getting used to social distancing and or wearing a face mask to the point that it does not cause anxiety anymore and they can practice reducing risk better.
Yeah, so I think that my hope is the way that we're going, we're getting more direct leadership advice about mask wearing. I saw just today, I think it is, Walmart, now you have to have a mask to go into Walmart. We have counties now that are saying you have to have a mask when you're outside. So I'm hoping that there will be habituation to that. I mean, I've noticed it personally. I've become much more comfortable wearing my mask to the point where I'll catch myself driving around alone in my car with my mask still on, right? Because I'm really not feeling like I need my mask in my car. So I do think that there's a potential positive aspect to habituation and kind of getting used to that. And hopefully under the direction of leadership that's pushing more towards these kinds of things, people will start feeling more comfortable, and that will just become sort of a new cultural norm. When you're any public place where there are lots of people, you wear a mask, you keep distance and things like that. So yes, I certainly think that could be used in a positive way.
Right. What would you recommend to someone who feels like they are making much less progress and growth in telehealth therapy than when they were able to have in-person training?
Yeah, that's, I think the therapists sometimes feel that too. I think when in any kind of therapy, there's so many individual differences. And so, telehealth therapy is very different. It's, in some ways it can be more intense, but you're also missing out on all that body language and, what I always call sort of the energy in the room. You can't feel that virtually, and that can be hard. And so sometimes it means that from the standpoint of being the client, are there other ways that you can communicate to your therapist what you're feeling? Or from the therapist standpoint, are there other ways that I can ask about that, or I can try to tune into what they're feeling? I would say, just on a personal level of being open and talking with your therapist about that, and that you're finding it more difficult, and see if the two of you can work collaboratively to come up with some ideas and ways that you can kind of reduce some of those barriers that you might be feeling until you can go back to that face-to-face. There are some, therapists that are going back to face-to-face too. So that could be an option also.
Great, thank you. As a history major, I'm curious to know if we have any data regarding how people have adjusted psychologically to pandemics in the past.
Yeah, that's a great question. And, I have not seen much, but I'm not a historian. So it'd be very interesting to know if, the 100-year ago pandemic, what we may have learned from that. Of course, that was such a different time then. We weren't so interconnected globally and things like that. But I don't know the answer to that question, but I think it's a great question. It would be a wonderful project for someone to do that.
I'm a historian, and I haven't seen anything about that. There's a lot of research on the pandemics, and I haven't looked specifically at what the psychological impacts are obviously very similar to what we have now, but I don't know that there have been studies on about them specifically. If I find any, we can put them up on Dr. Kilbourn's area of the lecture series. So I'll do some research for you.
Great.
All right. Do you think peer pressure plays a role in people's assessment of risk?
Yes, I would say definitely. It's not my area of expertise, but I think we can clearly see just in some of the behaviors and consequences that we're seeing in, some of our neighboring or not so neighboring states, of how that peer pressure of people thinking that, well, my friends are all back at the bar, must be safe to be back, or the opposite, right? The peer pressure of going somewhere, going to a social distance party and seeing everyone wearing your masks, and like, this is the norm here, so I better put my mask on. So yeah, I think that's a great area of research that could really impact interventions, is really trying to understand the power of that peer influence, peer pressure.
Right. And I mean, just thinking of the other side of that, what do you think about the people who are kind of trying to stay home, right? I mean, the people who have gotten used to that message, and now things are starting to open up. How do they kind of negotiate that?
Yeah, exactly. Yeah, so that's a hard, that's one too that's hard to know, but definitely I'm sure the actions of their friends and people that they trust in guiding their own behavior, and how they're sort of assessing their own risk based on other people who they feel have similar risk are behaving.
Right. So telling children to be flexible and that it will all be all right as they return to school concerns me. It may well not be all right. They may see classmates and our teachers sicken, maybe seriously so.
Yeah, well, I don't think that I didn't mean to give the message that I said it's all going to be all right in the short term, but that it's all going to be all right. We're going to be here for you and support you, and we're doing the best we can. I think that we don't want to, we got to have to strike a balance between not alarming them so much that then they're developing their own anxiety disorder about going back to school, but also being very open that we don't really know. I think it's not, as parents, sometimes it's hard to say. I mean, I found this with my kids when this all first started. They were not used to me saying, I don't know. I don't know what's going to happen. I don't know what the future looks like. I don't know when school's going to reopen. And that was really hard for them initially. We had a lot of like anger and frustration and all of that. Like, mom usually sort of knows, has some idea, and I was just being really honest with them. Now I think they've gotten used to that, but it's just a balance that you have to sort of decide for yourself, and knowing your individual children, what makes the most sense. I don't work with kids, I work with adults, so I'm probably not the best person to talk about, like, from the clinical standpoint. I can only talk about as my experience as a parent, what I've been trying to do.
Right. Well, the last comment, unless we have any more coming in, said you were awesome. It's a nice way to end. Unless there's anything else, I don't see. Let me see, Kristin. I'll check now. That was really great and some really excellent questions. So thank you, participants. And thank you again, Professor Kilbourn. Our next session on Monday is on the geographical perspectives of pandemics, geographic perspectives on emerging infectious disease, global pandemic, and COVID-19. So that's where we're going from here. Thank you for a great session, and we hope to see you all next week.
Thank you.